Half a day, everyone. Thank you for tuning in. We are here to talk about the 7 mistakes you are making to stay in pain. And maybe this strikes a nerve for some of you. But the number 7 reason, probably the most obvious reason you are staying in pain is, hello, are you ignoring those pain signals? Are you feeling some sort of pain? And when I say pain, people are like, well, it doesn't hurt that bad. Well, it doesn't matter. Your body is telling you that there's something going on. So say I have an ache in my shoulder, but it's not that bad. It's just kind of annoying. It's been there for a couple of weeks, but it's not going away. That's a type of pain signal that your body is trying to communicate to you. There's a dysfunction there. Something is not right there. So maybe after about a week or so, you're like, okay, I overused it. Maybe, let's give it another week and see if anything happens. And then, another week goes by and you're like, okay, maybe if I just stretch it, or something like that, maybe that'll help. That'll make it go away. Another week goes by and you still have it. So something you're not doing or are doing is keeping that pain there and failing to recognize that that is a signal. Your body is sending you a signal that something is out of balance or is in dysfunction there. That's probably the worst and the most obvious thing that you could do. And, depending on the time frame when you grew up or your parents' parenting style, maybe they were like, suck it up, you'll be fine. Just forget about it. It'll go away. That's not always the case. If there's something wrong there, it's not just going to go away because your body's trying to communicate to you something's wrong. So if you don't investigate it, you could further deteriorate that joint or cause more damage, in that area of pain. And by the time you get to a healthcare practitioner, you could be in so much pain that you can't even stand it. And guess what? You're going to take the quickest way out, which is not always the best route necessarily. You go to your doctor and they send you to PT and that causes more pain. And they say, well, nothing's helping, so let's just operate on it. And then that doesn't help. And then you end up here in our office, which is okay. We are definitely happy to help. And we have helped a lot of people pre and post surgery. It's a little bit easier to correct if you haven't been cut on, for obvious reasons. It's not natural to be cut on, but, we could definitely work to rebalance the area, the body, reset the joint, whatever we need to do to get that pain signal to stop, because after a certain point, the body is just used to sending that pain signal there. So sometimes we just need to reset that pain signal, and that will help tremendously. So rebalance that joint and reset the pain signal, and then you're good to go. No surgery necessary. So just when you start to experience pain, it's always best if you seek medical attention sooner rather than later. So